I welcome you all on behalf of Telangana State Yoga Jhana Parishad and Department of AYUSH for our training sessions on Common Yoga Protocol designed for International Day of Yoga and our awareness programs on COVID-19, its prevention, mitigation, and rehabilitation through naturopathy and yoga. Today's program will start with training session on Common Yoga Protocol, followed by awareness program on yoga therapy by our senior faculty, Dr. K. Sri Krishna of Gandhi Naturopathic Medical College. I request all the sadhakas to follow our treatment modalities in addition to the ICMR laid down standard protocol of treatment as adjuvant therapies. Now we'll start our session with Common Yoga Protocol training.
संगचत्वं संवधत्वं संवो मनांसि जानताम् देवाभागं यथा पूर्वे संजानाना उपासते संजानाना उपासते संजानाना उपासते. Do the palming. Keep on your eyes. Slowly open the eyes. Please get ready for Sukshma Vyayama. Get up, stand up. Now begin with neck exercise. Both the hands in wrist portion. Griva Shakti Vikas. Between 2 feet, 1 feet gap, just for balancing. Now inhale, head up. Exhale, down. Inhale, up. Exhale, right. Inhale, center. Exhale, left. Inhale, center. Exhale, right. Inhale, center. Exhale, left. Inhale, center. Touch the right ear to the right shoulder. Center. Left to left. Center. Right to right. Center. Left to left. Center. Now rotate 3 times clockwise. Those who are having neck pain, vertigo problem, please don't rotate. 1, 2, 3. Then anti-clockwise, viparit karani. 1, while moving upwards, inhale, and while coming down, exhale. Relax. Now get ready for shoulder movement. Both the hands straight. Inhale up. Exhale down. Inhale up. Exhale down. Inhale up. Exhale down. Now both hand sides. Inhale up, exhale down. Inhale left to left, right up. It strengthens your west portion, thighs, calf muscles, and it reduces the fat in the sides of the stomach, hip region, west portion, center. Relax. Now get ready for the sitting postures, Bhadrasana. Now gradually sit down, both the legs straight, Dandasthiti. This is known as the Dandasthiti. Now get ready for Bhadrasana. Fold the right leg, left leg, spine straight, neck straight. Bhadra means stable. Nischala Sthiti. No movement in this posture. The body is steady completely. Inhalation, exhalation should be continued. Maximum inhale and exhale. Spine straight. It strengthens the west portion, thighs, calf muscles, spine, shoulders. It will also increase the concentration. Relax, relax. Now get ready for Vajrasana. Again, come into the Dandasthiti. Fold the right leg, fold the left leg, sit on knees, Vajrasana. Turn aside, Vajra means diamond. The Vajrasana Sthiti. It will increase the digestion. It will strengthen the spine. It relieves the shoulder pain, back pain, and excess heat in the body and Apana Vayu. Now get ready for Ardhavushrasana. Slowly up, sit on knees, both the hands and back. Slowly bend back. Ardhavushrasana. It strengthens the spine. Remember that those who are having reeling sensation or vertigo problem, please avoid. Slowly down. Once again, up, down. Now get ready for Purna Ustrasana. Up, complete both the hands up. Now catch your right heel, then left heel. Purna Ustrasana, camel posture. Cover your soul with the palms completely. Purna Ustrasana. It's the best asana for thyroid problem, tonsils problem, vocal cord problem, snoring problem. Slowly up, relax, down. Now turn to the right side and come into the next posture, Shashakasana. Shashaka means rabbit. This posture is similar to the rabbit posture. Now both the hands up, exhale and both the palms down, slide, touch your chin to the floor. This is called the Shashakasana. Slowly inhale up. Once again, repeat the Shashakasana up, exhale down. It strengthens the spine, but remember that those who are having lower back pain, severe back pain, please avoid the Shashakasana. Slowly up. Now get ready for the next asana, which will strengthen your spine, shoulders, neck, spondylitis will decrease by this asana. known as the Uttana Mandukasana. Uttana means raising, Manduka means frog. When a frog will look upwards and raise its hands up, how the posture, the similar, the same posture, Uttana Mandukasana. Up, like Bhadrasana, it is also stable. It strengthens the shoulders, neck region, spine, inhalation, exhalation. Slowly down. Uttana Mandukasana. Once again, repeat up, slowly, gradually down. Relax. Knees together. Both the legs straight. Dandasthiti. Now get ready for the perfect posture. Vakrasana. Vakra means claw. Vakrasana. Fold the right leg. It cures the diabetes, back pain. It reduces the gastric problem. Now exhale and look at right side. Inhale front. Exhale back. It strengthens the spine. It relieves the back pain. It relaxes the diabetes and gastric problem. Inhale front. Relax. Change the position. Now fold the left leg and left hand back and with right hand press with your right elbow press the left knee and keep the right palm beside of left feet and look at left side back. Inhale front, exhale back. This is the best asana for diabetes, back pain, all the stomach disorders. Inhale front, relax. Dandasthiti and lie down in Shavasana. Shavasana, relax in Shavasana. Now let's together raise the right hand up, turn to the right side, come into the prone position, get ready for Makarasana. Makara means crocodile. Makarasana. Legs together and get ready for Sarala Bhujangasana. Both the palms beside our face, elbows and palms on floor, head up, chest up. Now elbow to shoulder, both the hands straight and concentrate between two eyebrows, Ajna Chakra. Sarala Bhujangasana will strengthen the lower back, L4, L5, tailbone, then gradually down. Once again, repeat it. Up, Sarala Bhujangasana. Slowly down. Now get ready for Bhujangasana. Both the palms beside of shoulders. Your fingertips, middle fingertips should touch same level to the shoulder and up to the Nabhisthana. Inhale up. Remember that those who are suffering with hernia problem, take a precaution or avoid. Slowly down. Bhujangasana will strengthen the total spine. It relieves the back pain. It strengthens the neck and throat. Up, concentrate between two eyebrows. Sarala Bhujangasana. After the Sarala Bhujangasana, this is the Bhujangasana posture. Navel region should not touch the floor and waist portion should not raise. Slowly down. Relax. Makarasana. Now get ready for the next asana known as the Shalabhasana. Shalabha means A grass worm. How the grass worm will occur looks like the same posture. Shalabhasan. Both the palms down the thighs. Before going to do the Purna Shalabhasan, we'll practice the Ardha Shalabhasan because those who are suffering with cardiac problem, hypertension, or hernia, they should not perform Purna Shalabhasan so that they can perform Ardha Shalabhasan. Raise the right leg up, down, left leg up, down. This is the Ardha Shalabhasan. Right leg up. Anyone can perform the Ardha Shalabhasana. Down, left leg up, down. Now both the legs at a time, Purna Shalabhasana. Remember that those who are having hypertension, cardiac problems, or hernia, as well as those who undergone surgery between surgery to 3 months, you should not perform Purna Shalabhasana. Sciatica problem, those who are suffering with sciatica, for them it's good asana. Both the legs are for sciatica, it helps a lot. It cures the sciatica. Slowly down. Once again, up, relax, down. Makarasana. Now come to the supine posture. Legs together, turn side and come into the Shavasana. Lie down and back. This is the best asana, Shavasana. But while practicing the Shavasana also, your mind, your vision, thoughts totally related to the body only. The internal journey, Shavasana. Legs together, get ready for Pavanamuk. Get ready for Setu Bandhasana. Fold the right leg, left leg, both the legs. Setu means bridge. Setu Bandhasana. The posture is like a bridge. Catch the ankles. Now lift the waist portion up as much as possible. Look here. This posture in this feet to knee. Both the legs are straight like the pillars of a bridge. Setu Bandhasana. It strengthens the thighs, calf muscles, waist portion, back. It relieves the back pain. Those who are suffering with back pain, they should perform Ardha Sarala Bhujangasana, and this one, Setu Bandhasana. Down. Repeat it. Up. Those who are suffering with back pain, they can perform 5 6 times. Sarala Bhujangasana, Setu Bandhasana, and they may hold 10 counts, 20 counts according to their capacity and age group. Down, relax, Shavasana, Sukhasana. Legs together. Now get ready for the next asana, Uttana Padasana. Uttana means raising, Pada means feet. Raising the feet. Both the legs, actually Uttana Padasana, both the legs we should raise, but initially we'll do the single leg. Those who are having back pain, they can practice by raising single leg only. Don't raise both the legs. Raise the right leg 30, 60 degrees, 30 degrees, down. Then left leg 30 degrees. Be concentrate while practicing the 30 degrees, 60 degrees. It should be 30, 60 only. 60, 30, down. Now Uttana Padasana. Both the legs 30, 60, 30 down. Repeat it. Both the legs 30, 60, 30 down. Now Ardha Halasana. Before going to do the Purna Halasana, we should initially practice the Ardha Halasana. By practicing Uttana Padasana, gradually Ardha Halasana. Both the legs 30, 60, 90. This is the Ardha Halasana posture. One can able to practice Ardha Halasana perfectly, then you will never get back pain also. But remember that it should be 90 degrees. If you will keep 60, 30 like that, the back pain will increase slowly. 60, 30, down. Those who are suffering with back pain, please avoid raising both the legs, single leg only. Relax. Now get ready for Pavana Muktasana. Fold the legs up to the knee, both the legs 40 degrees, 45 degrees. Hold them. Keep both the thighs on your stomach. And remember that while practicing the Pavana Muktasana, those who are suffering with back pain, neck pain, vertigo problem, shoulder pain, spondylitis, they should not raise the head. The remaining rest of the people raise the head up, touch the chin to the knee. Pavana Mukta Asana. In the name only it is mentioned that Pavan means wind. Mukta means releasing. Wind releasing asana is Pavana Mukta Asana. Head back, legs 45 degrees, down. Repeat the Pavan Muktasana again, both the legs 45 degrees, fold them, press to the stomach maximum. The Apana Vayu should release. Raise the head, chin, touch the chin. Avoid those who are suffering with vertigo problem, neck pain, shoulder pain, back pain. Head back, legs straight, down. Relax in Shavasana. Now slowly legs together, raise the right hand up, turn to the right side, fold the legs up to the knees and slowly get up, come into the sitting posture. Get ready for the Shuddhikarana Kriya and Pranayama. After the asanas, the body is very free and comfort to sit in a posture for a few minutes. So that sit in Padmasana or Siddhasana or Sukhasana or Vajrasana, any one meditative posture, and both the hands in Chin Mudra. Spine should be straight, and those who are having back pain, please take the back support compulsory. Now into the Kriya, Shuddhi Karan Kriya, and as well as Pranayama Kapala Bhati, only exhalation. Now to the Kapala Bhati, those who are the senior sadhakas or those who are practicing from the first day of this protocol session, they can continue 30, 20, 20, 20, 60 strokes. Those who are new giant, please 20, 20, 23 sets. Take a deep breath, only exhalation. Relax. Again, relax. Once again, relax. One can practice the Kapalabhati after a few days or 15 days, 1 month practicing 60 strokes, 120 strokes also per a minute. Now get ready for the another beautiful pranayama and compulsory pranayama. Everyone can practice this pranayama. irrespective of age group and the health issues, any health issue, you can practice the Anlom Vilom Pranayama or Nadi Shodhan Pranayama. Left hand in Chin Mudra, right hand in Nasikagra Mudra. Close the right nostril, left in, close the left one, right out. Now you practice 1:2 ratio. How long you will inhale, double the time you should exhale. This is the Nadi Shodhana Pranayama, Anuloma Viloma Pranayama. Slowly left out. Begin with left and stop with left. Anulom Vilom Pranayama. Anytime you can practice this pranayama. Now get ready for Shitali Pranayama. In summer it is compulsory, and those who are suffering with mouth ulcer or those who are or bodies are excess heat, if you are feeling, then you can practice the Shitali Pranayama. Hold the tongue like a straw and inhale. After inhaling, synchronize the throat. Jal andar band. Now slowly exhale through nostril. Once again, Shitali Pranayama. While doing the Shitali, at the same time you can do the synchronize the throat and lock the throat. It is called the Jalandhar Bandh. Slowly right out. In Jalandhar Bandh, actually we should touch your chin to the Kantapopa, but beginners, so that just hold like this only. Now get ready for Brahmari Pranayama. It will cleanse all the thoughts, disturbances, and it will make you perfect to concentrate on any object, your goal. Brahmari, initially Dhyana Mudra Brahmari. Take a deep breath. Like a bee sound. Now Shanmukhi Mudra. Shanmukhi Mudra means index finger on eyes, middle finger on nostril, ring finger down the nostril, little finger down the lips. And take a deep breath and close your ears with both the thumbs and do the Brahmari by lifting the middle finger from the nose. Relax. After the Brahmari, your mind is perfect, nirvichar sthiti, and it is ready to do the meditation. Meditation is that state the body and mind is completely light. Up to now, we practice the Sukshma Vyayama, Kriyas, Anulom Vilom Pranayama. These all are to get perfectness in the meditation, to sit in a posture comfortably for a few minutes, for practicing the meditation. Meditation is a journey towards the complete, towards the Anandamaya Kosha. It will cleanse the total mind and body, Panchakoshas, Annamaya Kosh, Pranamaya Kosh, Manomaya Kosh, Vijnanamaya Kosh, and Anandamaya Kosh. Meditation will activate the seven chakras: root chakra, Muladhara chakra, Swadhisthana chakra, Manipuraka chakra, Anahata chakra, Vishuddhi chakra, Ajna chakra, and it will open the Sahasrara chakra. One can practice the meditation anytime. Just concentrate awareness of the breath or concentrate between two eyebrows, Ajna chakra. One can practice according to their age group that much time. If you are 20, 20 minutes, 40, 40 minutes like that. Over to Sir.
That was a wonderful session of Common Yoga Protocol training. Now we'll start our awareness program. And today's awareness program is on yoga therapy by our senior faculty, Dr. K. Sri Krishna from Gandhi Naturopathic Medical College.
Thank you very much, sir. Today we will discuss about the importance of yoga in our day-to-day activity. Some points about that. So basically, when you see the word yoga means unity or oneness. It is derived from the Sanskrit word which means to join. Yoga is a means of balancing and harmonizing the body, mind, and emotions. So usually we say that according to philosophical concept, it's the union of our Jivatma with Paramatma, like it's a oneness, it's a unity. So these are all some forms of the yoga we can explain. So yoga not only comprises of asana, pranayama, it has got so many other techniques, like we say Ashtanga yoga. So there are 8 limbs of yoga: yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, samadhi. So these are all together, they comprise of the practice of yoga. So yoga can be done through the practice of asanas, pranayama, mudras, bandhas, shatkarmas, and meditation. These all together we make the our body healthy so that we can achieve physical health as well as spiritual and even the mental health also. It's a complete holistic approach. So next slide we can go. So before starting of yogasana, so we should be aware to how to start our yoga session or how to start our yoga practice. So that we can say like yoga, it's a sukshma yoga or joint releasing exercises. It helps to loosen up the joints of the body. So before directly going to the asanas, we can start like warming up of the joints. So this is also useful for energy blockages in the joints of the physical body. It releases and eliminates the energy blockages in the physical body and improving the coordination, self-awareness, and self-confidence. So joint movements, it warms up our body and it improves the circulation to the all over the joints so that they will be much more flexible. So it reduces stiffness. So it makes the body more comfortable and more flexible to achieve the maximum benefits of all the asanas or pranayama that we'll be doing over a period of time. So before starting of any yoga asanas, it's very much helpful that we practice this sukshma vyayamam. So that's all very important and very useful so that you won't land up in any stiffness or any joint problems. So next slide. So this yoga, next we'll go for asanas. Like after the practice of sukshma vyayam, all the joint exercises like flexing and extension of the toes, wrist joint, flexion, extension, elbow joint, shoulder joint, toes, and heel. So that warms up our body. Then we can go for asanas. So asanas are the physical aspects of the body that will help in so many various ways. Like there are many group of asanas. Initially, we'll be doing beginner group of asanas. So we can't go right away to advanced poses. So step by step, we'll be going some beginner group of asanas, then middle group of asanas. And after we attain very good flexibility, posture, we'll be doing the advanced group of asanas. So it's over a period of time that we practice daily. Like practice makes the man perfect. Typically, we have to go through step by step, not directly go for advanced group. So there are various group of asanas like Pavanmuktasana group of asanas, where you lie down and fold your feet or legs and press against the abdomen. So this group of asanas are very excellent. The name itself shows that Pavan Muktasana means Pavan means air, Mukta means releasing. So most of the people are suffering with like indigestion, gas formation, acidity, constipation. So this group of asanas helps to relieve the gas formation. They improve the digestive system and they remove the constipation, reduce the acidity, and they improve the appetite. So this group of asanas usually that will help us to all the removing all the digestive disorders and it will tone up. So this is one of the group of asanas. And also some Vajrasana group of asana like meditation poses or the breathing exercise poses with that we sit in do the breathing exercise. So like see, Vajrasana, all of you know, sitting in Vajrasana after meals is helpful for improving the digestion and absorption. So we recommend all the patients or sadhakas to sit for at least 10 to 15 minutes after meals. Like after consumption of meals, about within half an hour, you can sit in Vajrasana for 10 to 15 minutes. So the physiology is that it blocks the circulation to the lower limbs so that more blood is available in the upper half. That helps to improve the digestion and improve the absorption. So absorption and digestion requires lot of energy and lot of blood circulation. So that the Vajrasana is very much helpful. And all of you, we can have an advice that how some people will ask, sir, what is the benefits of yoga over other physical exercises? So most of us will be doing so many physical exercises. So the advantage is that suppose you go for other types of exercises like walking, running, jogging, swimming, or doing gyms, aerobics, etc., etc. So the advantage is that if you go for swimming, or swimming can't be possible in winter, so you can only do in the summer. Running or jogging or walking. Suppose it rains, so we cannot do that day. So that day our exercise is gone. So that's why comes the advantages of yoga. So yoga can be done 24 by 7 or 365 days. So there will not be any disruption. What we need is simple around 6 feet of space at any corner of the room, or say. So that suppose we go out of station, so you need not go for walking or running or playing, or so you can just do in the room itself, so that we can benefit the healthy benefits of exercise as yoga. So that's why we advise people to, or encourage to do yoga, because it can be done all throughout the year. So there will not be any disruption due to any weather, or ultimately we gain the benefits of the healthy benefits of yoga. So that's the advantage of yoga asanas over other physical exercises. So again, the regular practice of back bending asanas. So we got back bending set of asanas also that reduces the pain and keep the spine supple and healthy. So most of the time, at any age, we are succumb to or getting back pain. That's quite common. So what we do is we do back bending asanas, wherein the spine bends backwards, so that any pressure or compression on the back, it gets relieved, and ultimately the back pain will be gone. So the spine becomes more flexible. So according to naturopathy or yoga, we consider the spine to be a transmission tower. So we give a lot of importance to the spine. It's like a transmission tower where total body or total body, it gets the nervous energy through the nervous supply. So the nervous supply is nothing but the energy. So total spines, it supplies to the body, and that's only how it works. So any problem with the spine or nervous supply, it results in diseases, complications, etc. So we keep the spine flexible. So we say that the more flexible is the spine, the more healthy you are. So if somebody's spine is very stiff, so they can't bend backwards, sidewards, forwards, they'll be more prone for diseases or any derangement. So all of you keep in mind that we should keep our spine more flexible. So that's only possible through yoga asanas, wherein we have so many forward bending asanas, back bending asanas, spinal twisting asanas that will twist our spine in all possible directions, so that ultimately every cell, every tissue, every organ of the body, it gets the proper nervous supply, so that it will be working much more efficiently. So the ultimate aim of asanas is to flex the spine and improve all the nervous supply to various organs of the body. So that's how we achieve by doing all possible asanas. Okay. Next slide, we can go for pranayama. Next slide. Pranayama, it's like breathing exercises. After doing asana, we go for breathing exercise or pranayama. So prana means vital energy. That is the life. That is our what we air intake, what we take the air. Ayama means controlling. So controlling the breath or controlling the vital energy is known as pranayama. Pranayama utilizes breathing to influence the flow of prana in the nadis or energy channels. So that is the ultimate aim of our life. It usually utilizes the breathing pattern. A regular practice of pranayama improves the lung capacity and strengthens the respiratory system and balances the nervous and pranic system. So all of you know that respiratory system works involuntarily. So means unknowingly we take air inside, oxygen goes in, and carbon dioxide comes out. So that's involuntary without our innate knowledge. And so why do you need to do pranayama? So why it is necessary? So when you do breathing exercises or pranayama, what will happen is there will be 100% gases exchange. That means CO2 which is generated, it goes out, and oxygen goes into every alveoli, every nook and corner of the lungs. So when we do normal breathing, there won't be any 100% respiration takes place because it's superficial. Say around 30 to 40% only gases exchange takes place. So ultimately what happens is CO2 is left over in the lungs or in the body, and every tissue cell of the body may not get proper oxygen. So if you do at least 10 to 15 minutes of pranayama, wherein the leftover CO2 is eliminated completely out, and we get 100% fresh oxygen. So oxygen nothing but is a lifeline for our body, so that every cell and tissue will be getting good nourishment. So that it is advisable to take at least or do pranayama 10 to 15 minutes. That will maintain our health and improve our capacity, vital capacity. So that's it is advisable. That's a scientific basis. And also we got so many techniques of pranayama, as you will be knowing. We have learnt in the previous session. So Nadi Shodhana Pranayama nourishes the body with extra supply of oxygen. Carbon dioxide is efficiently expelled and blood is purified of toxins. So the regular practice of deep inhalation and deep exhalation, it gets the best benefits of removing the toxins and improving our capacity with fresh supply of oxygen, and CO2 is eliminated out. So it is possible through deep inhalation or deep exhalation through pranayama. So that is the benefits of pranayama. Next we'll go for other slide. That's about some mudras. All of you learned. There are so many mudras that will be very much useful, helpful. So mudra is described as the psychic, emotional, devotional gestures or attitudes. So it's a postures while doing pranayama, while doing meditation. They help in accumulating so much of energy in the body. So Jnana Mudra and Chin Mudra are important psychoneural finger locks, which makes the meditation of asanas more powerful. So these mudras, they help to concentrate on all the energy in the body, and it will be diverted within the body itself. So these are some of the gestures. The palms and fingers of the hands have many nerve root endings, which constantly emit energy. So these are our palms and fingers. They'll be having so much of energy channels. So doing this Chin Mudra, Jnana Mudra and Hriday Mudra, they tend to concentrate of energy levels within the body. So that will boost our healthy benefits while doing meditation. You can do mudras, even doing pranayama also. That will be more helpful. And regular practice of Hriday Mudra as shown in the figure, diverts the flow of prana from the hands to the heart area. So that's how improving the vitality of the heart. So Hrudaya Mudra is beneficial for our heart. It tones up the heart. This mudra is helpful for improving the circulation to the heart. That's how it makes our body more healthy. So these mudras are beneficial in maintaining our body more healthy. So these are all advisable. So next we can go for the last slide, that is Shatkarmas. Next slide, where those are all cleansing techniques in our body. Yes, Shatkarmas. Shatkarmas are the six group of purification practices. These are also used to balance the three doshas in our body. So all of you know that any disturbance or disease in our body is due to the imbalance of Vata, Pitta, Kapha. That is, Kapha means mucus, Pitta means bile related to the digestive system, Vata is the wind related to the all joints that land up in joint disorders. So these cleansing techniques, they balance these three doshas and ultimately give us the maximum benefit of health. Shatkarma means these are cleansing techniques like number one, neti. It's a process of cleansing and purifying the nasal passages. So we have learned earlier in classes about how we clean the nose. So Jalneti is a kriya wherein lukewarm water with little salt is added to the water and the Jalneti vessel is placed in one of the nostrils, keeping our head forward and slanted so that the water goes from one nostril and comes out through the other nostril. So there is also physiological explanation about the Jalneti kriya wherein the water we use is the hypertonic solution. Lukewarm water mixed with salt. So when it goes through the nostril, through the sinuses, this hypertonic solution, it attracts all the excess water or mucus deposited in the sinuses and it cleanses. So all the sinuses will be cleaned. Deposited toxins or mucus will be melted and that will be diluted and that will be cleaned. So all the sinus should be empty, but when it is filled with mucus, it becomes very toxic and lands up in sinusitis and other disorders. So doing Jalaneti Kriya with hypertonic solution, it absorbs all the excess mucus and it removes the mucus and cleans the sinuses so that it will be empty. So that is the mechanism or physiological evidence we give for that. And that is especially useful nowadays because of the corona pandemic, wherein all the nostrils are infected because the entry of the virus is through the nose. So this nasal hypertonic solution also acts as an antibiotic, antiseptic. So regular practice of Jalaneti helps to prevent as well as stop the further spread of viruses. Of course, it is also supposed to be an adjuvant therapy. You have to keep in mind following the standard ICMR protocol. So Jalaneti Kriya helps a lot in preventing respiratory ailments and removing the mucus. And Dhauti is the cleanses the entire alimentary canal from the mouth to anus. So Dhauti is a Kriya wherein we take in the morning 2 to 3 glasses of warm water mixed with little salt. So we take 3-4 glasses and we initiate a vomiting reflex so that all the water comes out. It's like Kunjal Kriya, we call it, how the elephant throws the water out. What happens is somebody is suffering with digestive disorders or excess acid formation. Whatever acid left over, it comes out. So it's like a cleansing the stomach. So that is also very, very important for all the digestive disorders. And we got Shankha Prakshalana Kriya also, wherein we take 2 to 3 glasses at every time and drink it and do 5 set of asanas. Ultimately, we'll be land up taking say around 20 to 25 glass of water, and it cleanses from mouth to anus. So all the large intestine will be cleansed and all the leftover toxins will be cleansed. So we got various kriyas in the Dauti kriyas. And Nauli also one of the kriya wherein it's massage and strengthens the abdominal organs. You do abdominal constrictions and relaxations. And Basti kriya is also a technique for washing and toning the large intestine. So it's like enema. It cleanses all the large intestine because constipation is the root cause of all the diseases we consider. And any excess deposition of morbid matter or toxins will be eliminated and the body is free of toxins. Kapalbhati is also one of the kriya as well as breathing technique. It purifies the frontal region of the brain and it removes the mucus. It improves the fire in the body so that any mucus deposition will be left over and will become much more healthy. Trataka is also one of the kriya wherein intense gazing at one point which develop the concentration. So usually we put up a candle and we keep on staring, gazing at one point so that ultimately our concentration will be improved and we get more into meditative form, like our concentration improves. So this is also one of the best kriya. So these are all the Shatkarmas wherein our body is cleansed of all the toxins and ultimately we achieve a healthy benefit and we become more healthy. So this is about Shatkarmas. Next slide. Thank you all for listening. Hope you follow these procedures and be healthy. Thank you very much, sir. Over to sir.
That was a wonderful session on the awareness program by Dr. Sri Krishna. Now, we'll end the session with Shanti Mantra. Over to our yoga instructors, Girish and Nirma.
Pranayama, Namaskar position. Get ready for Shanti part. सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः. Do the palming. Keep on your eyes. Slowly open the eyes, look your palms and do the namaskara, then do the Bhu Namaskara. Touch the forehead to the floor, then slowly head up, hands up. Thank you.